Ladies and gentlemen, boys and girls, hello and welcome to Swetha Stays Curious, the podcast where my endless questions lead to conversations, well, about everything under the sun. I am your host, Swetha, and yes, the name says it all. I'm such a deeply curious person, and I believe the way to understand the world is to ask, to learn, to have real conversations with the people who know their stuff. This, my friends, is our very first episode. I'm really excited that you guys get to hear the same. If you are a guy or you know a guy, be it a brother, a father, a partner, or a friend, then this, my friend, these are for you. This is for you guys. You might have noticed that talking about men's health isn't always at the top of the list for many men. It's often at the very bottom. So, for Men's Health Awareness Month this November, also known as Movember, I thought what better place to start than by getting curious about the same? Why is there such a gap? What are the things that we all need to know as a mankind but might be too hesitant to ask? To help me answer that, I'm talking with someone who works on the front lines. She is a fifth year medical student of Ajman University, which means she has a lot of fresh and current perspectives on these matters. She sees patients on a day to day basis, and she is here to help us spread the word about men's health. From the big stuff to the awkward questions that we all are afraid to ask. To the future doctor, Ms. Danaragini, welcome to the show.
Thank you, Shweta, for inviting me to this show, and I'm happy to be here.
Thank you. Thank you so much. So, from your front row seats in the clinics and the ER, what is the most common attitude that you see in your male patients? When do they come to? And what do
Hmm.
you think is the reason for the same?
Mm, Most of the men they confuse strength with silence. Many men are in the thought that okay, men are always supposed to be strong and they're not supposed to complain. We are actually seeding that kind of thought in men. Like, you're not supposed to cry, you're not supposed to say that it's paining. It's, thought of as a weakness. So, most of the men they push through the symptoms unless it becomes impossible to endure the pain. And that's when they come to the clinic when they cannot handle it. So, this is one of the most common mindset of most men over here.
You had stated that complaining could be a weakness. Why do you think many men treat toughing it out as a default setting for their health?
Yeah, that's what I said. No, they're confusing it with silence, and then they're not telling about their pain. They have like a kind of thought that, if I'm talking about my pain and, I'm complaining, then that's thought of as a weakness. So most of the men do not open it up until the symptoms they become like impossible to take it or endure. And so they come to the clinic very late. So this is the most common reason.
Got you. Beyond just busyness, what do you think are some deeper reasons for men to actually avoid the doctor?
Mm, Most of the men, exactly as I said, they don't want to feel weak. That's some kind of thought in most men nowadays, and most of the men, they're also. I have seen some people. They have a feeling that they should figure it out themselves. They do not want to go to the doctor, and we have some people are scared of what how the procedure will go and what would happen, what if there's some bad news, the doctor would say. And some people, yes, they are more embarrassed also to go and say some things to the doctor. They don't come up. And also sometimes like they feel like what if they're, there is some, their masculinity is affected or something, what the doctor might say, they what the society might say. So that stigma is there most of the time. Because of that reason, mostly men do not come up as soon as when they feel any early symptoms and visit the doctor. So it's very important to educate the men on this basis.
True, it's very important to actually regularly pay a visit to the family doctor, be it men and women both. Absolutely, regular checkups are very important. So, what is that one preventive checkup or screening that men consistently skip and that you wish that they didn't?
Mm, most of them do not even check their blood pressure. They don't check their blood pressure. Nowadays, it's very common to have hypertension, diabetes, cholesterol. So these basic tests are itself, it's like not, if that's not being screened properly, then we cannot even test for anything else. So first we have to do blood pressure. We have to check blood pressure because nowadays hypertension is actually, even we have a term for hypertension. It's a silent killer. That's why, since men and people are like skipping it constantly, it has become a silent killer. So we have to screen the men for blood pressure, cholesterol, diabetes. So these are the important ones, the common ones, which we shouldn't skip. Hmm.
And at what age should men actually be very concerned about cholesterol or like blood pressure levels? Like when should they be very proactive about the specific health numbers, like as you had stated, cholesterol, blood pressure, and so on and so.
Um, it depends. So first, we have to check about how much prone they are to hypertension, diabetes. Suppose if about in their family, if someone has any family history of diabetes, hypertension, you need to take them as on the first line and check their history, and then we have to start treatment or do screening for them. Otherwise, mostly if there's people, if they remain normal, then 40 plus, and every consistently we have to do every 2 years we can do the
Hmm.
check.
A routine physical checkup is what you mean. So what actually happens in these physical checkups? Like what are the doctors are actually looking for?
Um, you mean like these things are the ones which we do it through blood test as well as through the manometer. And so you're asking me, could you repeat the question?
Yeah, I was asking that what happens in a routine physical? Like what is the doctors looking for and what is the procedure of a routine physical checkup?
Physical checkup, they'll be mostly they'll be checking first they'll do your vitals, and then they'll be checking for the lungs, chest x-rays, heart. Then they'll be doing an abdominal exam, palpation they'll do, and then they'll check for the skin, pallor, then jaundice. These are the basic things, and if needed then we will go on like further, like checking the male's parts, private parts, and if it's needed then later on. It depends upon the patient's complaint, obviously, right? What complaint are they coming with? So
Hmm.
some people, some men, they have problem with urination. Some people,
Uh,
some men, they have pain. So accordingly we will be doing the specific checkups.
In these checkups, what can a guy ask his doctor to take more control and responsibility of his own health during an appointment?
Maybe he can ask to the doctor, like to us, like what more can I do and what more I have to improve in my lifestyle to have a long term health. Maybe exercise, food habits. So these are the common ones, and it depends upon whether he's taking alcohol, drugs, or anything. We have to first ask him to avoid it and abstain from it. So these are the
Hmm.
common things that we would generally say.
True. And what is the single most impactful change that a man can make to his diet? Like for a busy man, what is the single most change that he could make to his diet?
Um, Mostly it just not this doesn't apply to a man, it applies to everyone. So cut sugar, do not take sugar, cut your sugary intake, remove these sodas, energy drinks, and removing sugar itself solves like half of your problems, from your skin, from your health, your hormonal issues, everything will, like 6 weeks, everything, your body will be clean. So we'll first ask the patient to reduce sugar. Sugar is the baseline for all the health issues, obesity and fat. Do not consume too much junk, fried foods. So all of these are the basic things that the man can follow. Who's busy, maybe they can be cautious while eating food. So these are the things that we can do, and it can be impactful. It can be very impactful. Just cutting sugar alone can save a man from many diseases. So it can be very impactful.
I'm very guilty of this because I have a sweet tooth and I actually live and thrive on junk, which is very bad. And thank you for explaining the importance. It's very hard. It's
Yes,
easier said than done, to be honest. But a conscious effort and a deliberate consistency in the same
consistency.
would actually take you way too far. Speaking of consistency, what do you think of exercising? Is it a consistent effort, or can I just exercise on the weekends?
No, no, no. At least you have to exercise weekly at least 3 times. Weekly. Because when you're exercising in the weekends, it just leads to burnout. Because weekends are meant for you to rest. You're getting tired from work, you come home and you get those 2 days to rest. And those 2 days, if you're putting your body at work, at stress, going to the gym and working out, and when is your body going to get that rest? So these weekends are not enough. At least you can split apart daily to like consistent, half an hour, 40 minutes walking, brisk exercises, floor exercises. You could do something. And definitely consistent daily small, small sessions will make a bigger change. Even if you do not feel it at the point, definitely when you're doing it consistently for 30 days, at the end of 30 days, you will see a progress for sure. So something is better than nothing and being over burnt out. So avoid that. Do not keep it for the weekends. Allow your body to rest. Rest is something that we need to take. And many of us
Very
compromising. Compromising
agreed.
on sleep, compromising on everything. So rest is something that we need to. We need to make time. Okay.
Yes, agreed. Actually, rest is truly important. And honestly, I work on Red Bulls and coffees because I personally have lack of sleep and I'm almost sleep deprived on my working days. Speaking of which, what are the consequences of consistent poor health or sleep hygiene with respect to lack of sleep and its effects on the hormone levels and the heart health overall?
Mm, obviously, poor sleep increases your stress levels. Your
Mhm.
cortisol, there's a hormone called the stress hormone cortisol, it's going to increase. And you're going to be more stressed. And more stress means what? Heart diseases. There's risk of heart diseases. Again, weight gain. Your mood is going to be affected. You're going to go to the work in a very bad mood, bad memory. More importantly, in males, it lowers the testosterone levels also. It's set to low. So these are some of the main consequences and that the poor sleep is causing, and we are actually deliberately sacrificing the sleep to do other works. So
Agreed.
it shouldn't be done.
Absolutely. How actually stress is like a day-to-day part of our lives that we may not be able to completely get rid of. So, what is your take on mental health and stress levels and how it affects the sexual health for a man?
Mm, like it suddenly. Mm. See, specifically, uh, it affects their performance. Obviously, their desire. They wouldn't have the mood to. When you don't have sleep, you don't have mood to do anything. You just feel angry on everyone, frustrated on everything. So that's how it goes for men as well, right? They won't be interested in anything. So again, that will be a poor performance, poor desire. So these are some of the most common changes, that's noticeable with regards to sexual health.
Very true. So, if a person or a man or a guy notices a poor performance, or how do I put it better? Like when he notices a significant drop in his sex drive for that matter, is that something he should definitely bring up to his doctor and reach out to help?
Yes, obviously, if he's noting some, that's something like, a very common problem, because sometimes it's meant to cause like early heart diseases. So, sometimes, they actually feel it, like, they feel too stressed, and they can have this BP, they can have increased BP, hypertension can happen. So their cholesterol levels can increase because of that. See, because of one problem, we don't even notice there are so many changes that's going inside our body. We just think like, we are just skipping our sleep. Oh, we are just, missing our workout. Let me do it for today. Let me do it for tonight. It becomes an habit. Then it becomes an addiction. So this is when, if it becomes an addiction, then you're like the whole performance, you are like basically lost in the process. You will not be yourself. So you have lost yourself, and it's very difficult to bring you back from that position. So it's better to do an early prevention than to cure, you know?
Very
Yeah.
true. Prevention is always better. And it's the first step that you can always take towards, because prevention is better than the cure, as you rightly stated. How do you, as a future doctor,
Mhm.
naturally bring this up to a male patient?
Mm, we can, like we can casually like ask them like, how are you feeling, like, like how is your mood nowadays? Is it like good, or like are you feeling low? No, when we meet some patients, we can actually sense their vibe from them. When you have a, we have to establish a rapport with the patient. We have to, we have to talk to them in such a way that they have trust in us. They should be able to talk to us openly, like, okay, she's trustable, I can say my thoughts to her, I can say my pain to her, someone who would not judge me, someone who would not, make me feel embarrassed. So these are, when these things happen, and if you have a good understanding with the patient, and automatically it's very easy to, make them bring this up to you, and you can ask them, then they'll be free to communicate. It's just like a two-way connection. So this is how we do it.
It is actually, it is comparatively significantly harder for
Mm.
men to start talking about stress or anxiety as compared to physical problem like a back pain or something.
Yeah.
So completely agree on the take of yours. So what is that one common physical complaint that you hear that actually could be a underlying red flag for a mental health issue?
Mm, you mean mentally?
Yes, yes. Men's mental health.
Um, Most probably poor sleep. Patients come to you with poor sleep. If their mental health is affected, they do not sleep. Taking alcohol. Most of the men nowadays, they are consuming alcohol, drugs to get away from stress and get away from, you know, for that dopamine. They are just chasing that dopamine, so they want it, so they are doing it. And you can start asking about their daily habits, their daily sleep patterns, their daily energy, how happy they are to do, how happy they are, able to wake up every day and do their tasks. So with the help of this, you can actually find out whether they are going into depression, or like whether they are actually, having some interest to live their life. So we can actually find out in from these questions, from these interaction with the patient, whether, you know we can assess their mental health.
Very well said, actually. So, what if a person is feeling like guy is feeling off, unhappy, irritable, stressed, or just not himself? So, the idea, like as you had stated, it's a two-way communication. But for him, the idea of seeing a therapist is too much of a bigger step. So, what is a good, low intimidating first step that he could take to speak out about the same?
Hmm. First, he should have a trusted friend, a trusted family member, where he can go and he can speak about his feelings. And next, workout, exercise. It's a The word seems to be simple, just work out, just exercise. But the word has a deeper meaning. The more you work out, the more you exercise and you feel confident about yourself, you will actually, it's a great stress relief. Like, trust me, like when someone, like when you ask the men to exercise, and then when they're exercising, when they're going to gym, they're feeling better about themselves, and gradually all the stress just goes out from the brain. And I'm not just saying that going to the gym, and then if you're seeing looking beautiful, confident and healthy, means like you are perfectly all right or healthy. No, there's something called mental health. These are the things that you can make your mental health good, but these are not the only ones which where we can detect a person is mentally healthy or like physically healthy. That's different. So a person can be, when we see a person from outside, we can say that the person or the patient is healthy when they are physically good, but you don't know about their mental health. So
True.
these are the things that they can do. Always have someone trusted. This is not just to men, even to females. Always, when you have some thoughts, when you want to vent it out, please go and talk to your friend or trusted people, because they're always there for you. They won't judge you. So just go and yap to them, like how much ever. Exactly, just go and yap to
Um,
them.
yeah, which is almost what I do all the time.
Yes.
Anyways,
Yeah.
so
And most of the men, they do not know, do it. As I said, they feel like it's a weakness. So we have to first break this kind of thought that crying or explaining about your thoughts, it's not a weakness, and that's something that everyone has to do. Everyone has to do. It's not a weakness or it's not a shame. Like we have to encourage it. First we have to start from our part, then only it will spread, and we have to be the seed for it.
very well said. Wow, I'm just out of words now. So mental well-being. Many men, they take up such roles like provider, protector, breadwinner. How do you think such roles that they take and feel and think for themselves affect their mental well-being at the end of the day?
Hmm, that's not good actually. You know why? Because they thinking themselves as a protector or a provider, it makes them, again you are seeding the thought in them that they are unbreakable, they are strong. Again you are, what we are doing is we are saying that, oh, men are always supposed to be strong. That's what we are doing now. They are telling
Hmm,
them as provider and protector. They have a constant feeling, that we must be unbreakable, or we should not broke down at any time. So they hide stress until it becomes a burnout, it becomes a depression, and memory, mood, irritability, everything happens. So this thought, see, they can have a thought, okay, but it shouldn't be that men shouldn't always break down or cry. That should be, you know broken down. It should
broken down in themselves. Yes.
yeah, it should be. Yeah.
To be honest, these days, and this month in itself brought me to a notice to a term called erectile dysfunction, dysfunction, ED. So many men see issues like ED, erectile dysfunction, as a personal failing or just a part of getting older. But from medical perspective, what could it actually be a warning sign of?
As I said before, you asked me about the performance, and
Yes,
the so it can cause, and it's an early sign of heart disease, and
yes.
it can cause cholesterol, diabetes. Again, these are the common ones that most of the men get affected of. So these are the warning signs that they should be aware of.
So, when do you think such concerns like erectile dysfunction or the topic of male fertility in itself as a whole become a consideration for men's health journey as a whole?
Basically, when he's planning pregnancy in the next 1 or 2 years, if he's planning pregnancy, all of these factors would be considered important. Suppose we
Agreed.
have to check if he is a chronic smoker, and we have to know before itself, because it could be anything. It could be a mass, maybe a mass could be there in the testis, or maybe mumps could be there. Maybe there is a condition called varicocele. Even that can, cause infertility in male patients. So all of these we need to do checkup for him and make sure that, you know and all of these should be done if he's planning pregnancy in the next 1 or 2 years. So this is the time, like, we have to talk about these topics.
Yes. So when they are planning to actually start a family is when they have to consider these issues for sure. Uh, Also, could you actually kindly give an explanation about what prostate is and what the prostate is and what it does?
Mm, prostate is a small gland, and it's below the bladder, and it
Okay.
produces a fluid, and it's very helpful for lubrication, and it helps the sperms move. So this is the main function of it.
All right.
Hmm.
And also, prostate cancer is a
Hmm.
big focus in the month of November, which is also known as
Hmm.
Movember.
Hmm.
So, what should men know about the PSA test and the current guidelines around the screening of the same?
PSC, it's a blood test. We check for
Okay.
the prostate specific antigen.
Mhm.
And mostly according to the guidelines, we start at mostly 50 years. And then suppose if the patient is at high risk, then at 45. If he's at very high risk, then 40. It goes like that. And it's not a diagnostic test, okay? It's just like, a signal that we need to do further more tests. So, you know, that's how it is. Mm.
Besides cancer, that's
Mhm.
besides prostate cancer, what are the other common prostate issues? For instance, BPH, enlarged prostate, and what are their symptoms?
BPH is benign prostate hyperplasia, and and it's a benign condition. It's not malignant, so it's not a cancerous condition. Okay, and patients will come to you with frequent urination, and
Mm.
they'll have very weak stream of urine, and they'll start urinating even more at the night time. But in large prostates, is basically inflammation of the prostates. Patient will have prostatitis condition. So they'll have it, since it's an inflammation. Patient will have pain. They'll come to you with fever, and they'll have pain while urinating. Sometimes it can affect their sexual performance as well. So this is how, the other problems that could happen beside prostate cancer.
So, future doctor Ms. Danaragini, who do you think is more prone to prostate cancer, and what are the early symptoms, and how do they check for the same? Deal?
Mm, Mostly people who are above 50 years, and if they have any family history of prostate cancers, they have to go for an early screening. And people who obese smoking is for everything, not just for prostate cancer. So, and then diet, if they have a very high fat diet, and ethnicity as well, like mostly people from African ancestry, they can have, they are more prone to have. And again, as I said, they'll have problems with, urination, and they'll come with these issues, and they can feel a mass also. So this is how it is. Mm.
Yeah. There's
Mm.
one more thing that came into my notice when I was doing my research. That's something called digital rectal exam, so DRE. So this itself makes many men nervous. So can you like kindly walk us through what it actually involves and how quick is it?
Basically, this procedure is a very quick, safe, and it's a usually painless procedure. We have to, before doing the procedure, we just have to tell our patients that we have to inform. Before whatever procedure you do to the patient, you have to give a clear cut explanation, like what you are doing to them. So this will make them quite less nervous, and they'll be okay. Like as I said, build a rapport with the patient, build, they should have trust in you. because it's something intimate, right? Most of the patients would not allow you to do. And this exam is basically, you will like wear gloves and you will apply some lubricant, and then you will insert your fingers. That's basically, that's why it's called digital. Okay, so you will insert your fingers through the anus, and then you'll go to the rectum. You will feel the prostate, and you will see if the size of the prostate, the shape of the prostate. You will see if there is any lumps or masses as for prostate cancer. So, and see you, and then this is how we do, and it's usually, it's a very quick procedure, and it's very painless, as I said as well. So yes, this is all is about.
Okay.
Hmm.
So, on a day-to-day basis, you would be doing this. You've been immersed in this medical world for 5 whole years of your life now. What is that one surprising or impactful thing that you learned about men's health specifically?
Hmm. There's something, I have seen
Mhm.
how much untold suffering men carry. You know, that's something like kind of, you know, cute, or like it's kind of like good to know, but it should, which it shouldn't be like that. But how much, physically, mentally, like they are being forced into a situation that they cannot talk about their issues, as I said, because people might perceive them as weak, you know. So mostly, most of the men I have seen, they are not so over dramatic. They are so chill. They don't want to talk about their issues. So this is, even though it's kind of, cute and it's good at sometimes to see it, it's actually happy to see it, but which, this shouldn't be encouraged at the same time as well. They
True.
shouldn't, they have to go and they have to talk to their trusted ones. So this is what I wanted to like say to all the men over here.
True. It is a stigma.
Mm.
Sometimes certain misconceptions have to be, removed out. And if you could name a common misconception about men's health in particular, what is that one thing you would love to correct, given a choice? Please go on.
As I said already, just lifting weights, going to the gym doesn't make you healthy. There is something called mental. Mentally, you should be healthy. You
Yes.
have to be healthy. You have to sleep well, maintain a good routine, go for routine screening, checkups, hormones, maintain everything at a good, balance. Have a balance, basically, have a balance in your life. Everything should be in a balance. Don't go 70% or 90% work, 10% sleep, 80%. There should be a balance for everything. And I think whatever I'm saying at this point is not just for men. Even women who are listening to this can actually take up these points. So try to have a balance with things in life. Life will take you and make you a more balanced person. Mm.
Yes. And we say that when we are doing this call post midnight. Cool. So, yes,
Yeah.
looking at this next generation,
Mm.
be it our siblings for that matter, or be it the very next generation, complete next generation, what gives you the most hope about the future of men's health? What is that ray of hope that you see in today's children and today's youth?
The fact that we are doing this interview between us itself is a big breaking point. We are
True,
talking
true, true.
about,
I
yes,
completely agree. This in
because,
itself breaks the stigma
yeah,
that anyone and everyone can actually break the stigma if they, wish to speak out and be vocal about the
and
same.
and it's good to see, like, even people
I
in,
genuinely still can't
yeah. So like even people in
go.
like gyms, or like when I see some, like even when I'm using social medias and when I'm going through the reels and that, it's very nice to see people involving themselves in self-care, in involving themselves in groom, going to gym sessions. Like how much people have become so concerned with their physical health or mental health. And it's very nice to see the youths of our generations doing this, and you know let them keep doing this and break the silence and break the loop. Yes.
Very true. Yes. Honestly, I'm very surprised that this is like we're talking about men's health, and this is two women talking about the same. When both of us haven't felt it from their point of view, we may, probably understand their pain, but we've never felt it. We do understand completely because both man and women are a part of an integral part of the society, but we've never felt it, and we do understand the same. It's very unique experience, actually. It's definitely an experience that I'll definitely look back in the future. The future self of us will be really thankful, and I'm genuinely grateful that you had agreed to do this interview. So thank you very much. And what is that one last thing for our listeners, both men and women, that you would give it as a piece of advice?
All I would like to say is if something you feel like it goes wrong, if you're not feeling well, if you're mentally low, or something, it could be anything mentally or physically. Just don't keep up things inside you and pile up and, make it depress you and demotivate you. Go to your family member, someone trusted family member, trusted friend, go to a family doctor, someone, open up your thoughts, open, like vent it out. And because, see, the problems, they are easier to fix when they are small. If you
Absolutely.
progress them, and when if it becomes big, again, as I said, prevention is better than cure. So this is like one kind of awareness what I would like to tell to all of you.
Yes. So, for everyone listening out there, if I can try to summarize the powerful themes of today's conversation, is that it seems the biggest takeaway is to prioritize one's own health. It comes as a consistent effort, a day to day choice that we make. It's in those small choices like booking that checkup that you always put off, or talking to a friend about stress or mental health, or prioritizing an extra hour of sleep. And perhaps the most courageous thing a man can do for his health is to simply start the conversation with, as Dr. Danaragini, future Dr. Danaragini had rightly said, talking and starting the conversation, reaching out to the people that he trusts, like a doctor, a partner, or a friend, or a family, of course, for that matter. So, as we come to the conclusion, if this conversation sparked even a little bit of curiosity in you, it would mean the world to me if you could subscribe or do follow this page. And also do check out, do follow Ms. Danaragini. You can find our links in the description below. So do follow Shweta Stays Curious and Ms. Danaragini. Until then, it's me, Shweta Chokalingam, signing off, and take care of yourselves.